Hello, everyone. It's Monday, October the 26th. We have 2 additional deaths since Friday. Our 423rd death is a 70-year-old male from Cabell County, and our 424th death, an 87-year-old female from Marshall County. You know, it seems like to me that I want to double check that we were at 422 on Friday, but nevertheless it's 424 great West Virginians, and it's 424 too many. Every person should be recognized for their contribution to this great state, their family, and all the wisdom that they've given us. I tell you over and over, don't let these people be a statistic. We're almost numb to these numbers, and as we continue on, the likelihood of getting even more numb is probably great. So what do? We've got to some way muster strength from, God above, and He'll give us that if we'll just ask Him to do that. He's right here with us, and He's going to get us through this. Please, please, please keep these people in your thoughts and your prayers. It's 424 great West Virginians that we've lost, and so just hang tough, and for the families, we just hate it so badly. We have 317 positive cases that we've picked up in the last 24 hours. We have our daily percent positivity rate is at 1.28. So that means we've tested an awful lot. And all of a sudden, we have an incredible daily positivity rate. Remember, over the weekends, this is always somewhat skewed. Always somewhat, we don't have quite the number of deaths to report or whatever. So, don't hang your hat on this completely. I mean, the numbers are right, but from the standpoint of the weekend always skews things to some degree. We have a little over 5,000 active cases, 5,031. We're now up on our recovered cases to 16,768. That's good. And here's a number that's not good. We have 215 patients hospitalized now, which is a record high for us. Today, our effective reproduction number is at 1.08, which puts us the 8th best in the country. Now, what does all this tell us? What every bit of this tells us is in this nation right now, things are heating up and getting tough. Now, we know that. I think we have exceeded on some days 70,000 positive tests. Now, with that, West Virginia, please listen to me. West Virginia is not immune. There's no way. West Virginia is not immune to this disease. This disease is right with us. In fact, West Virginia is the most vulnerable of all. West Virginia is the oldest, and West Virginia has the most chronic illnesses. West Virginia is not immune. Now, with that being said, as this thing races across our country again, and as we race to try to get to that vaccine, or we try to get a better grip on what's going on here on a national basis, we got to do our part in West Virginia. So I know it's tough. I know the wearing of the mask is a nuisance and everything, but for crying out loud, compared to people dying, How much of a nuisance is it in any way? Now, absolutely, West Virginia, we've got to buckle up just a little bit here for hopefully a very short period of time. And hopefully that vaccine will come and come soon. Today we have one red county. It continues to be Wyoming. We're trying in every way we possibly can to help the good people from Wyoming County. I've got all my roots are in Wyoming County, and absolutely I want to help them in every way, just like I want to help all of our counties, but I especially have ties to Wyoming County, and I'm very concerned. We have 7 counties in the orange. That's Wetzel, Morgan, Braxton, Wayne, Boone, Mingo, and Monroe today. Like I said, the U.S. cases on Sunday hit the 7th highest day, or the highest 7-day average of COVID cases since this terrible pandemic began. I'm going to read that one more time. In our country, the 7-day average just hit the highest level that it has ever been with this pandemic. The 7-day average of new cases hit 68,767 on Sunday. 7-day average, we averaged 68,767 cases. Now, the 2 highest single days of new cases were on Friday and Saturday, in which they went in excess of 83,000 each day. Now, before I go any further, the numbers, I told you before, I may not be able to remember your name, but I'm pretty doggone tough on the numbers. And in fact, were the numbers 422 on Friday, Jordan? Is that right? Okay. Well, then we are correct and everything. The numbers are right, and we do have 2 additional deaths from Friday, moving us from 422 to 424. So I'm glad that we firmed that up. My concern was maybe it's a little different, but that's good. Our free testing is all up on our website. You can look and go where all of our free testing is offered. The red and the orange counties testing will continue to be offered in these counties. I encourage all residents to take advantage of this free testing. We'll be there. It's all on our website. You can pick up on that and everything. Go get tested. Please, please go get tested. Our drive-through pharmacy testing continues with Fruth and Walgreens and all the great efforts, that people are making there. That's just another ability for us to test. I watched on one of the morning shows this morning, and, it was brought up that I can't recall if it was the NFL or the NBA, but they were testing every day, every single day, and they had incredible good results from that because they were testing every day. And some commentator there said, well, if we could get in the United States where we could test everybody every day, it would solve all kinds of issues. And the other commentator said back to him, said, well, we're right now, in way in excess of the ability to be able to do 1 million tests a day. Now think about it. The commentator said back, well, there's 330 million people in the U.S. So really and truly, just to tell it like it is, the incredible milestone for us to get to the ability to be able to test 1 million people a day, if we ever thought that we could test our entire population every single day, right now, at the pace that we got and the abilities that we have, it would almost take a year to test everybody in this country one time. And so it still takes a big time effort to test. I encourage you in every way, where you have free testing in West Virginia or drive-through testing available to you at no cost, for crying out loud, just go get tested It is an absolute luxury that we have in West Virginia. Go get tested, please. We have 22 outbreaks and 74 confirmed cases in our public school system today. All that seems to continue to go well. We're watching it all the time. We're running to every fire. There's nothing immune. And absolutely, we've got to just continue to stay on top of that. And I salute all those from our first responder to our local health departments to the Department of Ed and all the different people that are really doing a great job there. And I thank our teachers and our service personnel for all the good work they're doing, and please just looking after our wonderful kids. We got to protect them and look after them, but they got to get an education. That's all there is to it. They can't just stop. Our education map came out on Saturday at 5 p.m. We had one county in the red, that was Wyoming. We had 7 counties in the orange, which were Berkeley, Wirt, Braxton, Wayne, Mingo, Boone, and Monroe counties. We had 7 counties in the gold, and these were Morgan, Pendleton, Doddridge, Webster, Jackson, and Kanawha counties. We got to keep testing. We got to keep testing. As far as our long-term care facilities, there are 49 outbreaks in our long-term care facilities. Our West Virginia churches have 14 active outbreaks reported in churches in 12 counties. I always want to read this because I want everybody to pay attention. If we have outbreaks in a county, in a church situation, you need to know it. And that's in Doddridge, Fayette, Mason, Mercer, Monroe, Nicholas, Putnam, Upshur, Wayne, Wetzel, Wood, and Wyoming counties. Again, a pew in between you, a face mask on, absolutely following the social distancing guidelines. Wear your face mask, wash your hands, do everything you can to help and look and look after the elderly. Excuse me. Our corrections update, we have 12 active inmate cases now, and we're down to 7 staff cases. From our flu vaccine, you should, check our website, check in different places and everything. You really need to get a flu shot. I think it's 6 months and older, but getting the flu shot is really important. We have $161 million plus, really we're approaching $162 million that has been awarded to our counties and our cities. Now, if we could just stop just a second and just think about it. These dollars have been absolutely a lifesaver in every way. I just got off the phone and talking with the mayor, and he said, it is just absolutely unbelievable what this has meant to us. We make our application, it gets processed, the money's come to us. It is absolutely a lifesaver in every way. And so cities and counties, please continue to apply. We'll continue to send this money out as fast as you can apply, and we can get you processed and everything. Please continue to apply. We have $25 million that's sitting out there and ready to go out the door in regard to helping those with utility bills, whether they be water or sewer or electric or whatever it may be. We absolutely, it could be natural gas as well, but absolutely it's setting out there. You should have already received. If you haven't, and you think you qualify, please get in touch with either us or someone with the public service, because if you've got a bill that is unpaid and it's a bill from March to July 31st, this past March through July 31st, we'll really get it taken care of for you. We'll really be able to help you if you'll just give us a call or give the public service people a call and everything, and they'll help you walk through it. And if they don't give you the satisfaction you need, call my office and we'll get on it. We'll try to help you as well. From a standpoint of our charts, The only thing I would tell you is if you'll look at the top chart, our recovered versus our active cases has gotten wider. It's gotten a good bit wider from the day from last week, and so that part looks a little bit better. You can see the second chart, our daily positivity. It's dropped below that dotted line significantly with a 1.28 number that we had today. But if you look at our cumulative number is still, it's still higher than we want it to be. Could very well still be the envy of the entire nation, but at the same time, in West Virginia, we want to be the envy plus something. And so the plus something is we got to get that number better. So again, I thank you all, West Virginians, for all the work. I thank you for listening to me. I thank you for following all these guidelines and everything. And I thank you more than anything for your prayers, and especially prayers for those that we've lost and everything that I call off every day. And I don't call them off to bore anybody. I call them off out of respect. I mean, that's the very least I can do. But thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I'll keep my comments shorter than usual. And just to remind people that we are seeing, as the governor said, the highest spike in the number of new COVID-19 cases than we've seen at any point in time during this entire pandemic, and have the two highest single-day totals over 80,000. It's also of note to recognize that there's only one state in the country today on the rt.live site that has a RT value less than 1. The rest of the country are all over 1, meaning that the coronavirus is spreading. And in Utah, they're starting to come up with strategies to look at rationing some care in their ICUs if things continue to grow, because our ICUs are over 85% full. And there's a couple of stories about people that didn't have COVID who almost died because they have such a severe limitation of ICU capacity, particularly one mom who had a heart attack. And just to remind people in the state that the reason why we are so consistent with recommending that people get tested and wear your mask and stay physically distanced is because we are trying to reduce the spread of COVID-19 so that we reduce the surge that can happen to overwhelm the health system, as they're seeing in Utah and El Paso, Texas. And for us, although we still have plenty of capacity on the COVID side, we are seeing more hospitalizations happen than we've seen, I believe, since the COVID pandemic has started. And with that, not ventilator use, but we're seeing more people go to the hospital with COVID. And that is very consistent. After about 2 weeks of seeing more cases, we'll see more hospitalizations. And another week or two after that, about 3 to 4 weeks from seeing a lot of new cases, we'll see people in the ICUs and we'll see people dying of COVID. So it's really important that we act today. And as the governor has called us to do, really demonstrate what makes West Virginia great, but also recognizing that West Virginia is a very vulnerable state. And if we don't really take care on this at this point in time to prevent the problems that might happen if we don't control the spread of COVID-19, then we could be facing some of the same issues that some of these other states are facing. So thank you very much.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our state health officer.
You're muted, Ayn.
Sorry. Good afternoon. I did have the opportunity last week to speak with Life United Methodist Church and a congregation. They offered me the opportunity to discuss life and work during COVID-19 pandemic. And we discussed the use of masks, not just in our community, but also in the church setting. And they also have these really nice masks that remind us about loving thy neighbor and the importance of wearing masks in your community. That is not just about yourself, but also the people around you that you love and also your community. So I just want to remind everyone to wear your masks, not only when you're going to church, but also during the entire services, also to socially distance, and then also when you're out and about in your community. But that was a nice discussion that we had, but thank you very much.
All right, thank you, Doctor. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Again, Governor Justice and I want to welcome back home the 157th Military Police. Came in on Saturday at Martinsburg at the Air National Guard base. Welcome to them and thanks to their families. We are moving to put an additional personnel on duty. We will have 450 National Guardsmen on duty. Just for some perspective for the citizens, over 1,000 of our West Virginia National Guardsmen, we have 6,400, have participated in support to pandemic response since we started in March. We continue to work testing initiatives as the governor laid out just earlier. We also are working a couple of initiatives today. One is supporting Kanawha County Clerk's Office and Nitro Police with sanitization of a polling station, as well as working with the Charleston Fire Department on sanitizing 2 locations. Continue to work a number of efforts with DHHR and are adding personnel to do not just contact tracing, but also case investigation going forward. And I would like to, on behalf of the governor and I, to thank the staff at both Mountaineer Challenge Academy North and Mountaineer Challenge Academy South. The Northern Challenge Academy is almost 3/4 of the way through their program for this group, and we are doing exceptionally well, and we have not had any significant issues with COVID. They're doing an exceptional job of staying masked. Our staff is doing a great job of staying within the guidelines and not bringing COVID into the facility, and the same with our Challenge Academy South. So it just points out that, as the governor and Dr. Marsh pointed out, if we stay focused and stay on top of doing the things we need to do, we can get through this. Thank you.
All right, thank you, General. Bill Crouch, Secretary of the West Virginia DHHR, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Yesterday on cable television, Mark Meadows, the White House Chief of Staff, publicly said, quote, "We're not going to control the pandemic. We're going to control the fact that we get vaccines, therapeutics, and other mitigations." That seems different from the message I hear at these West Virginia briefings. Governor and Dr. Marsh and others who may want to chime in, what do you think of this stated approach from the White House? Is it helpful to states like West Virginia that are on guard right now against the spread of virus? Thank you.
You know, Brad, let me make a stab at it first, and then I surely will, defer to Dr. Marsh. But Brad, I really don't think that the president's office is basically saying, let's quit trying to stop this thing. Let's just figure out how to manage, and with therapeutics and vaccines, and we're gonna try to go that way versus go the way of wearing masks and trying to minimize the exposure or whatever it may be. I absolutely believe that is the message that's coming from the office of our president. I think that the message is not that what they're trying to tell us is forget trying to prevent and completely go with vaccines and therapeutics. That's not the message, Brad. That's not it. The message is, without any question, the therapeutics and the vaccines are absolutely significantly helping us through this, because the ability from somebody getting sick and the many ending up on a ventilator and dying versus today, somebody getting sick and the medicines that we have are saving life after life after life. And the president is a perfect example. 3 days after he had this, he's up and going. He says he feels better than he felt before, and he's a living example. And he's the president, the most powerful office in the entire world. And so you see it every day. So the therapeutics, no question, are an incredible advancement that the United States has made. But in addition to that, the vaccines, we're all hopeful, are right around the corner. But I do not think that his administration is telling us, don't worry about prevention, because and I will promise you, your governor is telling you, and Dr. Clay Marsh is telling you, that the absolute power that we have right now, right at this moment, to stop this thing or prevent this thing is wearing a mask and doing all the preventative things that we're telling you to do. There's no question about that. No question whatsoever about that. Do we absolutely look forward to all the therapeutics that are being able to save lives today and all the vaccines that are right around the corner? Without question. So, West Virginians, just understand. I didn't see it, so I can't, or I haven't had a discussion directly with the president in regard to exactly what they think or whatever. But I can't imagine that anyone in the White House today is saying, we should discard the ability to prevent or the prevention, methodologies that we've been following and everything. No one, I can't, in fact, I know without any doubt. There's no way the White House is doing that. But we are really happy about the therapeutics, and we're very hopeful about the vaccine. But Dr. Marsh, please jump in.
Oh, you've covered it completely, Governor. I think that the only other thing that I would add, other than just to reiterate what the governor said, was that it's very much recognized today that people are very fatigued, and the maintenance of rallying everybody around the flag has become more challenging. People are exhausted from all of the constraints and the requirements that we have put on people. But I think that, as the governor said, we do have a significant power, even at this very moment, to protect ourselves and protect each other from COVID-19. And that power is to get tested to make sure that you're not infected and don't know it, pre-symptomatic, asymptomatic, wear your mask, and physically distance. And if you remember those three things, then we will be way ahead of where we could be in the worst case scenario, given how vulnerable our population is. And like the governor, I think that the president would not say to people, don't keep at it, because every time that you help reduce the spread of COVID-19, you're saving lives. You're saving people in West Virginia and maybe even beyond that. So ultimately is really up to all of us, and we do have power, and we want to exercise it, even though it's getting fatiguing for so many people. So Governor, I agree with what you said completely.
All right, thank you, Brad. Next is Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers, and I have a two-part question in regards to CARES Act funding. The other day, Mike DeWine, governor of Ohio, announced using $25 million of CARES Act funding and designating that for nonprofits, and also designating $20 million to support Ohio's art organizations. Those funds are meant to be used for costs incurred throughout the COVID-19 pandemic. So I was curious to know if we were thinking of something similar for nonprofit organizations in the state that obviously have had issues both with being able to fundraise and also have had their own COVID costs as well. And the other part of that question is, and this was either, correct me if I'm wrong, this was either last week or the week before, I think, Governor, you had said that you were going to announce some specifics on the funding, the $50 million funding for broadband expansion. And I don't know if that has happened or if you all are still thinking about doing that. So I was curious if you all had some details that you had that you're planning to release in regards to exactly how you're going to use that $50 million for broadband expansion going forward. Thank you.
Okay, Stephen, I'm going to work backwards on your question. You know, the first thing in regard to broadband, I probably am going to have to push that out until Wednesday or Friday of this week. You know, we're working on it. I think we're really, really close to putting the final touches and having that all put together and everything. And then we'll be able to drop the hammer on that and go forward. And you know, and I think everyone will be really pleased with the broadband initiative from the CARES side. But the bigger initiative on broadband is phenomenal. I mean, it's just off the chart. You know, with the approximately $800 million coming in from the feds to the SEO, to the Facebook lines, to all the stuff that's happening in the very near future. And by that I mean not in the 10-year future, but in the very, very near future, we're going to have broadband and high-speed connectivity across this state. I mean, in a really, really modern and terrific way, and we're going to have it really soon. You know, and this is a collaboration of a lot of people. You know, I was really, really happy to see, you know, and the majority, you know, from the standpoint of where we stand today, you know, in the legislature and the House and the Senate and everything, we all got together and made this incredible announcement and everything. But we welcome everybody. We welcome all the Dems, independents, everybody and everything, because this broadband thing is so essential. I've said it over and over. First, it seemed like it to me, and it was, you know, it's the schools, next is highways, and next is broadband. So it's the next highway that we really need to wrap up, and so we're really on top of the broadband thing. And let me go back to the other things as far as the money, you know, that maybe Ohio is now getting around to doing something for the arts. Well, we stepped up here not very far back, you know, with the, you know, all the dollars that went out to the arts in many, many ways and everything. Basically, we doubled down, you know, with everything in the world that our great leader of the band, Randall Reed Smith, has done such a phenomenal job. But he couldn't believe what we had done, and he tells you over and over, you know, my commitment to the arts is real. I mean, it's no bunk, you know. I mean, that's just it. You know, he said the people across the nation in the arts, you know, they've made reference to me being a rock star. I think that's a little bit over the top, but my commitment is real, because from the standpoint of contribution to who we are, again, we need to be proud of our arts and who we are in this state of West Virginia. So that's really, really, really important. And from the standpoint of our nonprofits, we're looking at it. I think we'll probably have you some information on that, maybe even as soon as Wednesday. But if not Wednesday, we'll be on it. We'll be out with it on Friday. We've been looking at it. I think it should be done. If we've got the money, we're going to do it. And so I think that should be. You should see an announcement on that on Wednesday or Friday as well. But anyway, thank you so much, Stephen.
All right, thank you, Steve. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I'm just wondering if there's any concern at all from the medical side of the panel about quality control in the labs that we have put into place to be testing all of the swabs that are coming from West Virginians. And we've had some contact with labs, some lab employees, et cetera. And there's some question on their parts about mold and how that could possibly generate false negatives in some lab test tubes. I'm wondering if that issue has come up to you, Dr. Amjad, Dr. Marsh, or Secretary Crouch, and if it has, if it's any concern to you at all on a widespread basis, and if it has, how do you think they're mitigating that? Thank you.
Well, Kenny, let me just comment real quick and just say this. I think in the state of West Virginia, and I think Dr. Amjad, if you'll speak first maybe, and then Dr. Marsh, but, this situation has not come to me. I mean, I may really be fooled. They may say, oh, no, we've got a real problem with this. I don't think that that's what they're going to say. But I can tell you just this, that across this nation, with us doing a million tests a day across this nation, there's probably reason for always having concern. And I hope that West Virginia continues to have concern, because by having concern, you'll stay on your game. You'll stay really tight about it. But anyway, Dr. Amjad, you lead. I don't have anything else that I can add.
Okay. Hi, Kenny. Sure. We always keep track of any of our lab specimens, and we keep in contact with our lab team at DHHR. And if there's a pattern of anything that doesn't look valid, we do go back and retest, and we do always keep a good eye on that. So we haven't seen anything abnormal to date, but that is a good question, and we can go back and discuss it with our team. But so far, we haven't seen anything. But those are questions that are going to come up, especially with a high number of testing that is occurring. But so far, we haven't seen anything, but we will always retest if there's a question of any false negatives that come across our labs. But I'll also defer to Clay if he's seen anything up at WVU that they're concerned with.
No, the only thing I would just add, and thank you, Ein and Governor, is that one of the reasons, Kenny, that we're really working very diligently to create our own testing capabilities in the state, including the test that's been developed at West Virginia University and using Q Labs, which is in Charleston, is so that we can really focus on a few providers for the big amount of our testing, so that we can make sure that we have a very firm hand on quality control, as you suggested. I'm not really aware of a concern of mold and causing false negatives. We do know that there are a lot of new sort of testing providers in the environment just because of the great expansion of tests that we've done. And so ultimately, we are vetting the labs, each lab before we sign up with them. But as the governor said, we're constantly keeping an eye on what Ein said. We're constantly keeping an eye on the results to look for anything that may be disparate in the way that the tests are returned, either disparate from a consistency standpoint in a place or with a provider, or say between antigen testing and PCR testing. So thanks.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the plans to sustain our testing numbers. I know we said last week that we had a few days where we exceeded 10,000 tests. Now that we have the testing in the neighborhood that we want, how do we keep it there going forward? Thank you.
I think, General Hoyer, maybe you can weigh in, and I could just add just this, that from the governor's standpoint, I mean, it's really simple. It's really, really simple. You see, I go back to workforce and processing the unemployment claims, and I said, we don't have we're getting way, way, way behind. Triple the number of support, and so we did. We tripled it. And it still wasn't enough. So I said, triple the triple. Then I said, from the standpoint of our testing and everything, General, you got to absolutely put all kinds of more teams on. He did. So I would just say just this, that from my standpoint, it's really just simple as mud. I mean, that's all there is to it. If this is a race, and it's a long race, and you continue to get better at what you do and more efficient at what you do, and as we continue to encourage West Virginians to come out and get tested, we'll meet the challenge. Whatever the challenge may be, if you'll come and get tested, we'll make sure that you get through, and you get through quickly, and we'll do whatever we've got to do. I mean, that's just all there is to it. It doesn't matter how many tests, units or whatever we're going to have to put out there. We'll do whatever needs to be done. From the governor's standpoint now, General, maybe you can comment, but from my standpoint, if I've got to request of you to put more people on, or whether it be in DHHR or stepping back and really helping our local health departments or whatever it may be, we're going to do whatever we got to do.
Yes, as the governor pointed out, we were directed to increase the number of available personnel to support testing at the local level, particularly the community-based testing. DHHR staff, led by Commissioner Christina Mullins under Secretary's direction, she is focused daily on all the testing activities. In addition to that, the Deputy Secretary, Jeremiah Samples, is working with local communities and the Guard supporting to increase. And one of the things the governor has asked us to focus on is not just the availability of folks to support the testing, but accessibility, and particularly accessibility during the appropriate times. So you'll see us start to continue to add pharmacies, local clinics, other access points within the communities so that testing can be done on a regular basis. And in addition to that, you'll see us also continue to modify times to allow more people who work to come through testing as well. But it is a daily priority to continue, and we'll see ebbs and flows dependent upon days and weekends. But the objective that the governor's pressed us to is to continue to stay above 7,000 tests per day. We have some numbers that we work per each individual county as well to try to stay on top of. Thank you.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. A question about who should get tested more often. Should certain occupations be concerned that they are more at risk for catching COVID? I'm thinking about people that work in restaurants, maybe coal miners, maybe truckers. Are there certain groups that ought to be getting out there and getting tested maybe every couple weeks or at least once a month?
Paul, my answer is real simple, and and then I'm gonna have to defer absolutely to the medical team. But my answer is really simple. The people that should be tested more are the people that are seeing people more. It's just as simple as that. I mean, really and truly, if you're a person and you're exposed to people more often, you ought to probably be tested every couple of weeks. And so and that would probably help us and everything, But anyway, if someone could jump on from the medical team.
Do you want to say something first?
Okay, I'll add to that, and then Clay can add. I mean, Paul, to answer you, it is who's more exposed to more people. I mean, most healthcare facilities have a testing regimen. The nursing homes now are getting either tested once a week or twice a week. So usually their employer will have a testing regimen for them. It's hard to say if someone, as you mentioned, a truck driver or a restaurant worker, I would say if they're going out of state or to a hotspot area, they would consider some type of frequency testing. But healthcare workers, their employer usually has something in place for them. But I'll see what Clay wants to recommend as well.
I was just going to point out the governor, I think, said it really well, as did Dr. Amjad, that we want to test people who have more contact to more people for sure. But we also want to test people that work around vulnerable people, because we know that, say, nursing homes, assisted living facilities, places where people are compromised because of age or pre-existing comorbidity, other diseases, chronic illness, those are the people that we are very worried about taking COVID from the community and bringing it to those folks. But other occupations, as you mentioned, Paul, and the governor and Dr. Amjad mentioned, are, I think, spot on.
Back to me just one second. I want to say this too. We've made an effort to try to do testing that it extends into the evening hours and everything from the standpoint of, you know, our everyday working people that can't get there. I mean, just can't get there, and we have to have flexibility. So we're working on flexibility with the health departments and everything else, and so anything we got to do to be able to accommodate and get the people tested, we're going to do.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi, I want to ask about the nationwide spike in numbers. Obviously, I don't think increased hospitalizations would be connected to increased testing. So what's going on with this increase across the nation? Are people getting careless and overconfident because they're numb and fatigued, or does the pandemic have natural ups and downs? Could you maybe enlighten us a bit more on what's going on?
David, I'm going to pass again to Clay and everybody, but I'm going to tell you that my 2 cents, and you know, I'm always the guy that, you know, I'm not going to dodge a question. I'm just not going to do it. I'm going to tell you the truth the best I can, but let's just think for a second. You've got the fall, and so, you know, there's lots of places across this country the weather is really terrible and cold, and you got the fall, and so that's driving more people to be inside, and that's driving more positives. It's got to. You've got the election going on, and you've got people running everywhere and everything, and you've got that, and that's got to be causing some level of issue. And you've got all the sports things that are going on in lots of different places. You got us back to school now, and all that, and every bit of that is compounding this problem right now to some level of degree. Now, what are you going to do? What are you going to do? We're just going to decide we're going to batten down the hatches. We're not going to go outside. We're not going to have an election. We're not going to play sports. We're not going to go to school. We're not going to do, you know, I mean, for God's sakes, a living. I mean, if we do all that, we know the consequences there could be multiple times greater than the consequences of trying to deal with this. And so you got a president that's given everything that he has in order to try to deal with it. And surely to God above, you know that you've got a governor that's absolutely doing everything in my power in any way and every way I can to combat this. But anyway, Dr. Marsh, maybe you could add a little bit to that.
No, David, I think the governor is quite correct in his assessment. But I think it also goes back to something that actually might be a little bit more foundational and a little deeper, in that we've said this before, but I do believe it bears saying again, that this is a pandemic. It's a generational event. You know, we are creating our evidence base as we go. We're trying to understand how we can intervene as we go. But this virus does have a rhythm to it where, you know, it is moving in many ways of its own accord. And we know that it moves most quickly person to person when people don't do the things that we've talked about, when they don't get tested. And as the governor said, we're trying to not only create more testing capabilities, but we really want people to show up and get tested. And we want to continue to work with the state of West Virginia to do that. And we want people to wear masks, and we want people to stay physically distanced. And we know that if most people do that, then we can affect this reproduction score, the person-to-person contact, like we have a vaccine. And we also know parts of the world that have either has put forward as part of the reason we know that small gatherings of family and friends by the CDC is a big issue right now. And we know people are very tired of all the restrictions. But whatever the cause is, we know that COVID-19 is now more prevalently spreading in this country and around the world than it has at any other time since the beginning of the outbreak. And we need to then start to work very aggressively to prevent the ramifications of that, the impact of that, the consequences of that, which involve more people going into the hospital, surging the hospitals, more people dying. And so I think that irrespective of absolutely the cause, of which we may not know, we know the approach, we know the intervention, and we just got to do it. And it's really, it is the time to do it right now. Thank you.
All right, thank you, David. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I want to follow up a bit on that because every meeting, every briefing you have, you advocate wearing the mask, washing hands, keeping distance, and getting tested, and people are doing that. I was down at Pipestem State Park over the weekend, and the compliance by the staff and the guests was 100%. It was excellent. Yet our numbers are going up. Every state, just about every state in the nation has numbers going up. So I'm wondering, are you considering any additional measures, such as maybe reducing crowd size again at sporting events, whether it's high school, college, or professional, reducing crowd events from 100 back to 25, reducing maybe the number of people that can be in a church at a given time? It seems all the measures you're suggesting are working to a degree, but the numbers keep going up. So it logically sounds like we may have to consider some additional measures, and I'm wondering if you are and what they are.
Mark, I've said it 5,000 times. Everything has to always be on the table. I hope and pray that we're not going to have to close anything else down, restrict anything else, further than we already have. I am totally aware of the fact that, that for whatever the circumstances may be, that the numbers are spiking all across our country. We're listening. We're absolutely watching everything. I'm going to listen to the experts, the medical team, and I'm going to absolutely let them guide me. I am not, no way, I am not in my makeup going to sit back and say, well, Jim knows these medical people, they don't know what they're talking about, and I'm not going to listen to them. No way, no possible way. I mean, really and truly, that's what they're here for. That's why we listen, because they have the expertise, and that's what is going to drive us. They're going to drive us. And so with all that, naturally, I'm going to keep my mind churning, and I'm going to keep my head up and everything. And if I've got to say, now, wait a minute, are you sure about this? And double, triple checking everything, sure, I'm going to do that. When our color codes came out on Saturday, I had them go back and double check again. And then after they came out with that, I had them go back and double check again and everything to make absolute certain and certain beyond a doubt. Really and truly what we found? We found that with the first on the first run, they were right, and they continued to be right. I questioned it, and I pushed them, and I made them go back and double check it twice and everything. And they're doing good work, and we listen to them.
All right, thank you, Mark. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Governor, I wanted to ask you about the letters you sent out on official governor's letterhead to the eligible households for the utility benefits, which letters that I'm told duplicate what's already been sent out by the utility companies. Can you give us some estimate of how much it costs to send out these letters, and also where the governor's office obtained the mailing lists for these eligible households?
Phil, honest to goodness, I can't keep a straight face. I mean, I don't really know. I don't really know about the letter. From the standpoint of notifying the people, we surely want to notify the people. From the standpoint of it going out with a letter with my letterhead on it, I don't know about that. But absolutely, I mean, Phil, do you realize we deal with people that are dying? I mean, people are dying here, and we're dealing with hundreds and hundreds and hundreds of millions of dollars that we're trying to move the deck chairs around and do correctly. I mean, For crying out loud, you know, if we've sent something out and the postage is wrong, I'll pay it myself, honest to God. If that's a big issue with Phil, I'll pay it myself. I mean, you know, but at the end of the day, I don't know. You know, but I'm sure with all in me, you're talking to a governor that drives himself, gave up his salary, feeds himself, feeds his troopers. Absolutely, without any doubt, there's no chance on this planet that I'm going to try to send something out with the governor's, you know, with postage on it and the governor's, you know, letterhead or whatever. There's just no way. It is silly to be talking about such stuff. I mean, that's all there is to it. This is giant, tough stuff, and we want to try to continue to do the right stuff about every bit of it. We know that we had, you know, one last thing. We know we got utility customers. You've got utilities that are hurting because they can't get their bills paid. We're absolutely pushing in every way to not have them cut somebody off. You got people that are scared to death that they're going to get cut off. And so as these people are hurting and everything, you know, the net of the whole thing is just one thing and one thing simple, and it's just this: we got to try to help them and try to help them in every way. And there's one last thing I want to tell you this: that the utilities included our letter in their own mailing, and so I guess what I'm saying is there wasn't additional postage that I know of, and I'm getting that from some people here, but as the utilities notified their people, from what I've been told, just in the cleanup here, our letter went with their postage.
All right, Governor, I'll turn it back to you to close out.
Okay, I'd like to. I would, you know, while we're on this, you know, and don't get me wrong. I don't begrudge any question. I just wish to goodness, Phil, that we would really dial into things that are, well, I won't say that. I was going to say something funny, but I probably won't go there. But, well, let me say this. I will say this way, but I'll never forget Bob Pruitt. Bob Pruitt was coaching at Marshall, and there was issues, and one of the assistant coaches was dwelling on something, and he looked at the assistant coach and he said, "Do you realize you're talking about rat pellets when there's elephant pellets all around us?" And you can take it from there, but that's really what we got going on. I want to make sure that we get the elephant pellets right, and before we really are wrapped up in something that is maybe not even significant. But just think about this just for a second. Mike Hall came up with the idea, and he came up with the idea because he had heard so many people that were hurting. And he came to us about this. And he said, with the PSC, there's people out there that just cannot pay their utility bills. So is there any way to help those people? Any way in the world to help them? Well, so we started digging, and the PSC had to completely vet this thing. And then our utilities across West Virginia, we had to get a whole lot of vetting that happened from them. Then we went to BDO and had BDO vet the same thing, and my office vet the same thing. So it took a little while, didn't it? And then all of a sudden, the very second that we got the green light to go, we go. And then there's somebody out there in some political camp or reporter or whatever like that, and they say, well, they're doing this now right before the election. And I would say to them, bull snot. We're doing stuff as quickly as we possibly can, everywhere we possibly can to help our people in the state of West Virginia. You know, so with all this, you know, to me, this is almost kind of a spin-off of just that. I'm telling you, we're going to help our people of West Virginia, and with all in me, I've said it until I'm blue-green. I don't care if you're a Republican, an independent, a Democrat. I really care that you're West Virginians and want goodness for our state. And that's what I have done since I walked in the door. That's what I'm going to continue to do. I am absolutely just nauseated every time we get running down a political path and everything. We don't need to do that. We don't need to do that. And the sheer fact of the fact that, you know, Hyperloop comes and makes their announcement, well, they made their announcement in their due time. I'll promise you to God above, we didn't tell Hyperloop, well, we want you to make this announcement in, you know, right before the election. Is the simple fact in West Virginia, whether it be West Virginia methanol, whether it be Hobet, whether it be broadband, absolutely, do you not realize that when the federal government comes out and says there's $776 million that can come to West Virginia, but Governor, you've got to change and do something with an executive order that gives us the ability to get that stuff here, and it is on October the 29th. Now, I didn't make up October the 29th. I didn't make that up before an election or whatever. I mean, it's silly. It's silliness. There's lots of good stuff going on in West Virginia. We want to keep on doing it. So we're going to try to get money out and you know, and protect our people in West Virginia that are struggling with their utility bills. And I'm sorry that I just don't know. I don't know about the letter going out on my letterhead, and I don't know what envelope it was in or anything. I just don't know anything about that. Nevertheless, that, you know, oh wait, I'm sorry. I've got two more things real quick. You know, first of all, again, a super welcome back to all those, you know, National Guard members that just came back, and we're very, very, very happy to have them back. And we're saying many prayers all the time for all those that are deployed and that continue to look after us in every way, all, you know, each and every day. And super congratulations to both Mountaineer Academy North and South and everything and all the good stuff they're doing there. It's really, if you've not been to one of our Mountaineer Challenge Academies, you know, you should go. I mean, it's amazing to watch just all the good stuff and how these young people their lives are being impacted and changed and molded into a better way and a better course to where, frankly, we would probably lose an awful lot of them. So that's really good stuff. And the only other thing that I'd add is just this. I'm going to go back, and now you have my pledge to even do more. General Hoyer doesn't know anything about this, nor Secretary Crouch, nor anyone, you know, in my administration, because I just wrote it down here as we were going. I just get the feeling that really in my gut, we need to step it up one more notch as far as our testing, and so and as far as the expediting of our tests and everything. So I'm going to get with all the powers to be, and today I'm going to give you my pledge that we're going to do more. I don't know how much we're doing exactly, but whatever it is, we're going to do more. And the only thing is, we'd just like West Virginians to keep coming out, keep coming, getting tested. So that's all I got today. And thank you so much. Appreciate you.